I want to give my heartfelt welcome to everyone for joining us today. I know these are very unsettling times, and I want to express that we hope to continue to serve you as best as we can, and we really appreciate your trying out our new way of communicating and delivery through these Zoom teleconferences. I want to also especially thank our panel of experts from our department, Environmental and Occupational Health Sciences, from FEMA, Washington State Labor and Industries, and our CE staff for helping us deliver today's roundtable. With information changing every day due to COVID-19, we decided to offer a roundtable discussion in place of the pandemic course that many of you registered for. In the workplace and our communities, we know you're dealing with many occupational health issues, and we hope the roundtable will give you an opportunity to ask questions and provide us feedback on how we can best serve you. The roundtable will be facilitated by Dana Stahl, and we've chosen a number of questions that best represent the conditions that some of us are facing right now and that are most relevant. It's, as I said earlier, it's changing every day by the hour, so we hope these questions are still relevant today. Dana will present the question, provide some general guidance, and then open it up for our panel of experts. And we encourage you to please participate through the chat function that Jill explained how to use, and we'll be able to truncate those questions for you so the panel of experts can give you their feedback. I'm going to now turn it over to Dana, and thank you again for joining us today.
All right, thank you. I was originally scheduled to teach the pandemic influenza course that we were going to offer in April. As we moved away from in-person classes, we were looking at developing an online presentation. Information was changing so quickly that we really decided this would be the best format. So I want to acknowledge other members of the team putting the course together. Of course, Nancy Simcox, Kate Durand, Sarah Woltz, Jill Teep, and Becky Yost. So thank you very much. I want to introduce our panel members. So Dr. Peter Rabinowitz and Dr. Deborah Cherry are both with the Department of Environmental and Occupational Health Sciences. Peter Rabinowitz is also is the acting director of the UW Meta Center for Pandemic Disease Preparedness. So very fortunate to have him on the panel today. Dr. Deborah Cherry is also a board certified physician with Harborview, director of UW Medicine Occupational Environmental Medicine Residency. I'd like to welcome Matthew Bernard. Matt, for many years, was the regional NIMS coordinator in Region 10. NIMS is the National Incident Management System. He recently retired, so congratulations on your retirement, Matt, and thank you for coming out of retirement to help us with this panel today. And also John Stebbins, who's an industrial hygienist with the Washington State Department of Labor and Industries. So welcome, thank you. Okay, so I'm going to start with the first question. The first question is, what guidelines have been created to address the assembly of seasonal workers? Every year, twice a year, thousands of commercial fishermen and fish processors are assembled, trained, and sent on to Alaska to work on our ships and in our shore processing facilities. These crew come from all over the world in every state within the US. What measures can we take to screen arriving crew and help assure their health and safety? So I looked for resources on this. Probably the most relevant resource I was able to find comes from the International Chamber of Shipping. It was published March 3rd, 2020, looking at data mainly from February. So some of this, things are already changing. So some of what's in this guidance is more applicable than other content. But just kind of to summarize what they recommend is on shipping, personnel entering ships should be screened before boarding to make sure that they don't have symptoms, they haven't been in contact with people with symptoms, really increasing infection control measures on board. If any crew members do exhibit symptoms, have a plan to isolate them, manage their close contacts, and then if you have medical facilities, incorporate safety measures at the medical care facilities as well as cleaning and disinfecting. With that, I'd like to turn this over to, I think, Dr. Cherry and Dr. Rabinowitz first to see your thoughts on this question.
Debbie, do you want to start, or few things I could say.
You go ahead, Dr. Rabinowitz.
Well, thanks a lot, Dana, and thanks to everybody who put this panel together and the opportunity to speak to people. I think that this is an important issue because we've seen already on ships that some of the highest risk groups are the workers on ships, and we've obviously seen this from the cruise ship incidents like the Diamond Princess. And the basic question is, you know, there may not have been historically a lot of medical screening of people who are going to be taken up to Alaska to work on the ships in the canneries. But when you think about the actual risk that you're taking on as an employer, many of these people are going to be sleeping in close proximity with each other, working in close proximity with each other. And it really, I think, is worth doing this idea of screening before boarding with a good basic medical screening that could include certainly temperature check and screening for any current symptoms. And I think it would pay off in the long run, because if there starts to be outbreaks in a worker facility, it could be on a ship where people are often bunked very close together, or in a fish processing place where there's a barracks for workers. This is really going to be a big problem for an employer. So I think it's very much worth doing the pre-screening, and then if anybody's having symptoms, acting pretty quickly and realizing that isolation of workers did not work very well on the cruise ships because they were just so much in contact with others. So it really means probably getting them out of that facility and evacuated or put in a different place if they're really developing symptoms. And also making clear these days we're getting more access to testing, and I think I would look ahead of time about what are the possible ways to test very early and have tests available on the boat that could be somehow transported to a lab and tested, because you want to jump on these things quickly and not have them get out of control. And I'll stop there.
Hey, Dr. Cherry.
Yeah, I think some of the same precautions that the World Health Organization recommends for reducing transmission in general would apply to gatherings of commercial fishermen and fish processors, which is just the frequent hand washing, availability of hand sanitizer. If you cough, cough in a flexed elbow into your sleeve rather than into your hand. And if you're sick, stay home. I mean, the threshold for staying home while sick I think is a little lower. And, if you're a ship captain or in the commercial fishing industry, just kind of reviewing your sick policy, and say if someone becomes ill on board the ship, maybe having a little lower threshold for contacting the Coast Guard to evacuate that person and see what's causing their illness.
Okay, thank you. John or Matt? Why don't we start with John? John, any thoughts from a regulatory perspective?
I think some of the things that we've been finding are being sure you're controlling expectations, or being clear on what expectations are for people to do what isolation they can, and to and what's going to happen if somebody gets sick, so that everybody else can understand what's going to happen and know what's being done to protect them. And then some of the areas we've run into issues are around with the increasing cleaning, and often using more potent cleaning materials, being sure that they're on top of their HAZCOM program, and using proper protocols and PPE for that as well.
Okay, so if you're using different disinfectants, we need to make sure employees are trained on the disinfectants and compliance with HAZCOM.
Mm-hmm.
Thanks. And Matt Bernard, any thoughts?
Yeah, the thing that I would say is planning is really important. In other words, if you hadn't put a plan together, particularly on, for your ship, that should be done before you take off. In other words, it needs to be done ahead of time, looking at all the different factors, including, who's in charge. And if that person in charge gets really sick, how do you're out in the middle of the water, how you may not be able to get back in very fast. So you need to kind of set that up and not have to deal with it right on top of that. The other is I have a background in industrial hygiene, and with your disinfectants, you need to not only make sure you've got your MSDSs and do that, but you also need to before you get out there, are these disinfectants going to be effective? In other words, if you don't know if they're going to be effective and you use them, one, there's a false positive there. The other is you may be exposing people to chemicals that they didn't need to be exposed to. So those are my points.
Okay, so disinfecting is key. And Jill mentioned that we were putting together a resource page. We have a number of resources that we're going to be making available on disinfection. So EPA has developed a list of disinfectants that are effective against COVID-19, and other research. Nancy, I know, has done a lot of work on safer chemicals that would effectively kill coronavirus and still maintain worker safety. So thank you. Any other comments on this topic before we move on? Okay, so let's move on to the next question. This question is about PPE. And as we all know, we're running low on PPE supplies right now. The question is, our ships and our shore facilities are the healthcare providers for our crew and communities. How can we get the PPE that we need with all of it having been taken up by the hospitals? So just to put this in context, I wanted to point out that OSHA has come up with a guidance document for risk employees during the COVID-19 outbreak. And they based this very heavily on a guidance document they had put out a number of years ago on maintaining worker safety during a pandemic influenza. So one of the first things you would want to do is look at a risk assessment for your employees with regards to risk of COVID-19. And OSHA breaks this out between, from very high risk down to a lower risk. They define this very high risk exposure employees are employees who are performing medical procedures that are generating aerosols. Also mortuary employees who might be doing aerosol generating procedures. High exposure risk would be healthcare workers who are working with known or suspected pandemic patients, or people who are transporting pandemic patients in enclosed vehicles. A medium exposure risk employee might be somebody who has high frequency of close contact with the general population. I'm thinking right now that might be grocery store workers. Some of the general population may have infections. Low exposure risk employees are employees who have very low contact with the general public, such as office workers. The guidance also lays out what type of PPE should be made available to employees in these various classes. Respirators are definitely recommended for anybody in a high and a very high risk occupation. Respirators, people working in medium risk operations may wish they had respirators, and we'd like to provide them, but really in a shortage, the respirators are going to be going to employees in high and very high risk occupations. I also want to point out just something else. President Obama, a number of years ago, I believe it was 2012, signed Presidential Policy Directive 21, which had to do with critical infrastructure and resilience. Identified a number of operations that need to maintain operational during an emergency. So even if everything else shuts down, critical infrastructure has to be maintained. And so some of what's included in critical infrastructure in regards to this question, especially healthcare and public health, that's what's going to get us through this pandemic. If healthcare workers aren't available to treat us when we get sick, really, we need our healthcare workers. Food and agriculture, that's also on the list of critical infrastructure. So we need to maintain our food and agriculture system. So putting it in that context, I think, let's start with Matt. Can you maybe speak to how we would distribute supplies like respirators and PPE in an emergency where really our resources do not meet the demand?
Yeah, what happens is, I'll start at the top. If you go to the national level, they're looking at at very broad categories, okay? But the information that they're getting comes from the states and FEMA in their regions, and they get it from the counties and the cities. Okay, so as the requests come up for resources, because FEMA is now enacted to basically do that now. That's why they put FEMA in its level 1 area or level 1 level, because they have the connections, you know, to all the states, and as the states work down to the local levels. Now, getting the material is going to go to, as they look at what's the most critical, and Dana, you mentioned it, and it's, you know, the public health is going to keep us alive as we go through this. However, you also have, you know, I'll give you one example. For example, what happens if all the people who deal with electricity get sick? Okay, all of a sudden, who's going to be taking care of the electricity? What if all the people who are dealing with agriculture get sick? You know, how are we going to get food? So they're going to be looking at it from a standpoint of where are the critical needs at that time. Okay, so what I would suggest, say, even to the fishing industries, if you have an industry organization, you'd be contacting either the county that you're working in or contacting the state operation to say, hey, you know, we feel we need these, and here's the plan that we have, because we're going to be out fishing for long periods of time. We're going to critically need this stuff so that we can bring back the food and so forth that we have. That's from a you know, emergency response, emergency management plan point. That's how it's all going to work.
Okay. John, any comments on that from a regulatory perspective? What do we do for employees who should be wearing respirators when respirators just aren't available? How do we handle that? How is L&I looking at this?
Well, we're going to the CDC guidance on dealing with respirator shortages. They've got guidance for preparation for shortages and for extreme shortages as to how to identify best use for the respirators. What we're seeing with this in the healthcare industry is that, you know, there's a lot of respirator use that's been used for, the presumption is that the respirator should be used as much as possible, and they're having to get down to look at where it really is necessary and how to work with the resources and identify the specific need for a respirator before they be sure the people who need them get them, and places where it would be advisable or but not necessary, that sometimes those folks use a different procedure. The other thing that we're looking at is being sure that on our hierarchy of controls, respiratory protection, PPE is the lowest level. So going back up that hierarchy of controls and being sure that the engineering controls, the administrative controls, work practices are all optimized to limit the need for the respirator. So we're not relying on the respirators as much.
And I've been seeing, I saw in the newspaper that hospitals were calling on seamstresses to sew N95 respirators for hospital staff. Any thoughts on that?
They're not N95s.
Yeah.
Surgical masks.
Right. No. Correctly. How would L&I, from a regulatory perspective, look at somebody wearing a homemade mask sewn out of cloth as opposed to a respirator?
So, we do not consider anything that isn't a NIOSH approved respirator to be appropriate. The places where there's some movement on that is like the strategic stockpiles. There's a lot of those respirators that are out of date. And so there's some ways to deal with that and be sure that, so NIOSH has gone through and retested those respirators and identified that the filtering capacity is still there. In most of those respirators, actually the problem is the elastic in the straps or some of the fitting pieces, like the nose bridge might be failing. So if they can be examined, if they're in good shape, then they're useful. What I've seen for the homemade things are more replacements for surgical masks. And from a PPE perspective, a surgical mask is not a respirator. It's very useful in with the COVID-19 virus, which is primarily being transmitted person to person by droplets. That they're a good face shield, so from that perspective, some of this homemade stuff might work for that. But there are also things like actual face shields that might be put in place and might be more reliable that somebody could look at as well.
Okay, so basically you're suggesting that rather than a homemade respirator, which may give somebody some, a sense of security, but that's more of maybe more of a psychological benefit. Maybe using a face shield that can be cleaned rather than a homemade mask.
Yes.
Okay, thank you so much. And I'd like to turn this over to Dr. Cherry and Dr. Rabinowitz. Do you have any thoughts on what workplaces can do when, PPE is just not as available as we would like? How can workers protect themselves?
Dana, can I interrupt real quick? It looks like Dr. Yost wants to say something, so I'm going to let him say
I
something.
wanted to ask John a question. So on the reuse of respirators, there is a CDC approved procedure that has been used in the past to put them in paper bags. I was wondering if anyone has tried using disinfectants or possibly UV light to disinfect respirators after they've been used in order to allow them to be reused. UV light is especially effective against viruses like this.
It's a great thought. Yes.
Yeah, I am not aware of any trials with that. There's going to be a limited amount of reuse you can do with something like an N95 filtering face piece, because eventually it's just going to sort of break down anyway. They're not meant for long-term use. But if you can extend the use, a lot of times also it's sort of a strategy of being sure that they're not disposed of too soon. If you have somebody doing triage and they're wearing a N95 and they see somebody who has a sprained ankle, they haven't actually been exposed, and so they might reuse the respirator after that. But when they actually have a respiratory disease that they deal with, then that's a point where they might dispose of the respirator.
Yeah. And OSHA in their pandemic guidance has talked about reuse of respirators, basically saying that if the respirator is not wet, it's not dirty, it can be reused. If you're reusing it, I would suggest that you store it in a clean container. And when you're handling the respirator, recognize that the outside of the respirator may have picked up some virus. So if you're touching it, don't touch it, take it off, put it in a clean container, and then wash your hands so that you're not transferring potential infectious agents from the outside of the respirator to, say, your face or your eyes or another surface. Thank you, Dr.
And certainly be careful of transferring anything from the outside of the respirator to the inside of the respirator.
I can post a link to a short video that explains how the CDC reuse guidance can be implemented. So I'll send that out to the chat.
Yeah, and we can also add that to our resource page too, if you send that to Becky or Jill. Thank you, Dr. Giss. Dr. Rabinowitz, Dr. Cherry?
Yeah. Well, what I got from the question was that it was the one question is, if you have medical people working for the company that are providing medical services to employees and they can't get the facility, they can't get the equipment because the hospitals have it, I would make sure to reach out, as someone said, to the local health department and explain the situation, because basically the company is doing a service by being able to provide those medical services, and that if they're not able to get the equipment they need, then I think they should be telling the health department that they're going to be sending those patients to the local hospital or local clinics because they can't handle it. So I think really making it clear that they're part of the healthcare system and they need the adequate equipment as well and on the local level.
Okay, thank you. And Dr. Cherry?
Yes, for workers who are not working in healthcare and not treating patients with respiratory illness, there's a lot to do to protect yourself from the virus without using respirators. And it's a lot of the usual things that I mentioned earlier: hand washing, cough in your sleeve, stay home when sick, and also social distancing. I know, like in commercial fishing, sometimes there's a large meeting where they go over safety precautions and instructions for the season. But in those types of meetings, if they can be done by telephone or video conferencing like we're doing now, that can help with social distancing. And also, if there does need to be an in-person meeting, to have distance between the chairs, maybe have every other chair with 3 to 6 feet between participants if possible, and making the hand sanitizer widely available, instructing participants to cough into their sleeve and not to shake hands. All those can help reduce transmission of the virus and help protect folks. And also wanted to briefly address one of the questions on the chat, which is, what if we're in a remote area and what if someone tests positive? Well, for most people who have mild to moderate symptoms, you're at no disadvantage being in a remote area because we don't have any drugs approved to treat the illness. We don't have any drugs to prevent it. And the instructions for most of us, even if we're not in a remote area, are to stay home while sick, treat it like you would a bronchitis or something like that, rest, and try to avoid spreading the disease. But in the case of coronavirus, to be most cautious, stay home until you're symptom-free for 72 hours instead of what we usually recommend, which is 24 hours.
Thank you. Any additional comments or thoughts on this question before we move on?
Yeah, this is Matt. One of the things that as I'm listening to all of this is, we're talking about putting, people talking to each other and having programs set up is again, I'm going to talk about planning. Okay, so if, a pandemic is not something we deal with all the time. So in the planning for the industry that you're working in, there needs to be that plan, particularly for ships going out, some type of plan set up. In other words, you've thought it through. If in fact I had someone who has comes up with the coronavirus and they didn't have it when they did the initial testing, all of a sudden you're going to need to have some type of procedures set up so that we may have to isolate on the ship, do those types of things. And so, again, think about that. In other words, these are things that need to happen way ahead of time. The other is one of the things with if in the question on being out in some type of facility for processing, if that particular area also is set up for people coming in from outside with multiple bunk rooms, then again, you're going to have to think about, this is different. Okay, so we need to think about how are we going to deal with this in those multiple bunk rooms that can go on board ship as well. So again, something to think about, something to put forward.
So like Dr. Cherry was suggesting, if you have a meeting, you set people up every other seat. So maybe, can you bunk people so that every other bunk is empty, perhaps?
Yeah, but for isolating a positive person, they really need a lot more than that. They're going to really need to get off the ship or get put in a place where they're just really able to not have any contact.
Agree.
Yeah, absolutely. Okay, thank you so much. And let's move on to our next question. Sorry, my slide seems to have frozen up. Jill?
Sure. We have a question from Mary Miller on measures that are specific for growers or farm workers.
A number of health departments have put out some guidance. It's basically has some similar situation with the fisheries, that if you have farm workers who are all in close housing with each other, you should really go through the same steps, which is, as Matt Bernard said, have a plan, do some health screening ahead of time, make sure that you're not putting people on housing who already have symptoms, who have recently had contact with a positive person or anything like that. Have a contingency plan for being able to quickly diagnose and isolate somebody who is positive, and make sure that in the agricultural facility, you have access to some of the things that Debbie was talking about in terms of hand washing facilities, and that if you have particular situations of congregation like a lunchroom, or that it's really small, or you have safety talks where everybody gets together in a small area, you should really try to not do that and do it differently.
Okay, thanks. And okay, I've solved my first technical difficulty of this session. I've been able to move on to the next slide. So the next question that was submitted was, while there appears to be general consensus on how most COVID-19 information, the information concerning how long the virus lasts on various surfaces seems to be all over the place. I've seen estimates ranging from hours to 9 days. Is there a more definitive answer? And actually, between the time this question was submitted and today, study did come out. It was published in the New England Journal of Medicine on March 17th as a letter that did a study of viability of the coronavirus. And based on this study, it says that the coronavirus is viable in aerosols for 3, maybe more hours. It's viable on plastic surfaces up to 72 hours, stainless steel 48 hours. Copper is I think, our friend in this pandemic situation. The virus does not survive more than 4 hours on copper. Cardboard, no viability after 24 hours. And we'll post a link to this on our resource page. Of course, the study was done under very specific conditions. And so the question is, is this applicable for other conditions as well? That said, why don't I turn this over to any of our panel members? Does anyone feel comfortable expanding on this? Deborah Cherry.
Well, I just wanted to say, I think the more important question is, how is the virus transmitted? And it's primarily by person-to-person contact with someone who's infected, by respiratory droplets. If you're within 6 feet of an infected person and they cough or sneeze in your presence, that's how it's most likely to be transmitted. And while the question of how long it lives on different surfaces is important, and we should pay attention to cleaning, just keep in mind the main way it's transmitted is person to person through respiratory droplets.
The other thing is what we've been saying all along is, wash your hands, don't touch your face. It's really truly putting that, this hand right here doesn't touch this, because if you could have had people sneezing if you didn't breathe it in, and if it's on the surface, you put your hand there and touch your face, or along that line. Again, it's got to be almost become some type of a regular process that people get in their heads.
Yeah, and I personally find the evidence about aerosols troubling. We always are worried that we're going to be too reassuring that everything is droplet transmission. If you've got aerosols lasting 3 hours, there certainly brings up the possibility of aerosol transmission. And it just shows that, first of all, we have to make sure that people are not generating aerosols, and that means covering your cough and things like that. And I think using some abundance of caution whenever there's a possible exposure situation, realizing that aerosols survival is going to depend on some of the things Dr. Yost talked about. A lot of ultraviolet light, a lot of sunlight is probably going to kill an aerosol quicker than in an enclosed space where it's dark or something and it's the right conditions. But it just means we have to be really careful with this virus. We're still learning that in some situations it may be more transmissible than the standard advice.
Yes, we're still, recommendations are going to continue to evolve as we learn more about this new virus. Dr. Yost, any other thoughts? Can you maybe expand on infection control in terms of what we've learned about viability? Or perhaps John?
I guess one of the things to consider is that if it may be viable for some period of time on that surface, but if surface can get cleaned, and then you don't have to worry about that. And then also the personal hygiene steps are important to keep on practicing.
Yeah, and certainly, you know, the one question the study did not answer is, we know, you know, maybe they answered a few questions on viability on surfaces. It did not answer how transmissible these viruses are from these surfaces. So that may be ongoing studies. We may learn more about that in the future. Any other thoughts or comments on this question from any of our other panel members? Matt? Okay.
I had another kind of related question. I think that we're also seeing more and more data related to risks associated with asymptomatic transmission. Maybe the panel can speak to what we're learning and the newest information about asymptomatic transmission.
We think that there's a spectrum of how much virus people produce into the environment, and you know, I think a person who's coughing and sneezing a lot is simply going to be putting out more virus particles. But it does seem that some people will shed probably at much lower levels, even when they don't have a lot of symptoms, and they potentially could transmit if all the other hygiene things are not being followed.
Any other thoughts on this one, this question? And if not, I'm going to ask Jill to maybe read off some of the questions that have been coming in through the chat box.
We've been keeping up pretty well with the questions on the chat box. So if anyone on our who's attending today would like to pose anything more here, we do have a new one from Kane. Kane's talking about that we have an assembly line style production facility. How should we go about distancing workers who would normally be standing shoulder to shoulder for 16 hours a day?
Okay, would one of our panel members care to take that question first? I think some of the previous recommendations are, you know, maintaining social distancing. We want to maintain at least 6 feet between people. So if it is possible to spread your production line so that people are standing at least 6 feet apart, that would be in line with our social distancing recommendations. Dr. Cherry, Dr. Rabinowitz, anything to add?
I think it's a problem. It's a real, it's not always, I saw the other chats, someone pointed out that you can't always expand your production line, make it 3 times as long because you've only got so much space. And I think it's a tricky one, and it's a high risk situation, and you definitely want to make sure that you're screening really well, making sure people are not doing a job like that sick. But there are many workplace issues that cannot be totally changed in terms of putting 6 feet between people, and that's just the way the buildings have been designed and the lines designed. And I think it makes the industry have to decide, can they keep running the line in this way, or is that just too much of a risk?
And Dr. Rabinowitz, when you talk about screening, are you asking workers to self-report symptoms? Are you talking about maybe a temperature screen on every employee as they report into work? What's an effective screening method?
I think we're still looking at different ones, but I think that things like temperature screening is something that some employers are considering and have tried before. And the problem, and also, I think looking at, and I'm not quite up on the developments nationally, but the question of, has any of the national legislation made it easier to have a sick leave policy that keeps people at home? Because if you don't have a sick leave policy and you ask people to self-report, they just won't do it because they need the money. So you have to balance your sick leave policy with the screening, and hopefully you have some sort of sick leave policy, and maybe some of the federal legislation will help with that. And I think it's very reasonable to consider things like temperature screening if you have the staffing for it.
Excellent. Yeah. And Matt, can you maybe expand a little bit on, I think, Peter, you made a very excellent point about sick leave policies, and people who need money may fail to self-report because they'll be sent home and not get paid. Matt, you talked about planning. How would something like this play into planning?
Well, the company in and of itself, you know, they have their regular safety plans, but again, remember that most companies don't think about a pandemic. Okay, so this is kind of new territory. There are template plans. I sent one, I think, I don't know if you put it up there, from that FEMA has on there to think about all the things you need to think about. There are checklists that CDC's put together that you can essentially use as part of your process as you're thinking about what you're going to do. The other part is keeping in touch with your counties and state people, because as the doctor said, there are national things that are happening right now, and that stuff's going to be moving fairly quickly. So that means that the company needs to have somebody that's actually keeping up with all of this, and that's part of your planning process. Somebody that's looking at all the media and the so forth that's going on. So those are things that the companies can do. But from the standpoint of you know, having the line continue on when you can't move it, and you know, you can't get the social distancing, you've got to make some decisions, and that's where those, you know, people can go home in the sick leave pay if that comes in from the government. The other thing is having something set up so that you can train. Let's get into the training process. To train, if you're going to continue on with this in this environment, needs to be a training process set up for your personnel so that they understand, you know, this is the new life of what we're going to do, and that's part of your planning process.
Thank you so much. And John, when you're talking about training OSHA compliant or L&I compliance in Washington State, can you comment on this?
Yeah, that's something, certainly if they have to replace workers or bring in new folks, that may be an issue. I'd say also with a situation like this, they should consider, just as they didn't plan on having personnel programs around a pandemic, they didn't design the line around having a pandemic, but if they take a look at it, there may be other ways to you know, slow down the line or do something to make it work with some of the social distancing, and you know, there may be changes they can make to ventilation and things like that that might help to protect people. That, you know, it's not always as complex as this was not considered in the design of that line. If you consider it, there may be some things that can be done fairly easily.
Yeah. One issue I dealt with during our H1N1 pandemic was a question of, what if somebody develops symptoms during the middle of the workday? Can we send them home? And then we ended up with people reporting their coworkers. There were a couple people who just didn't like each other, and so they took turns reporting each other to HR, hoping their colleagues would be sent home. Maybe Dr. Cherry, Dr. Rabinowitz, can you comment on what kind of symptoms you would be looking for if somebody developed symptoms in the workplace and you needed to send somebody home? And of course, this should be something that would be written into your plan ahead of time. And you know, workers would be trained on that. If these are the symptoms you present during the middle of the work shift, you need to be sent home. What would you look for?
Debbie, you want to take?
Sure, yeah. So fever, which is a temperature over 100.4. Cough, which is a new cough not explained by one of your chronic conditions. If you have seasonal allergies and you always have a cough, that doesn't count. But if you develop a new cough, or you develop new shortness of breath, again, that can't be explained by your chronic underlying conditions, or muscle aches. And not, you know, I thought about this in the context of commercial fishermen who often have aches and pains, but this is new body aches that are akin to what you would get with the flu, not your normal underlying back strain or knee pain, but new body aches. Anything, new symptoms along those lines, new cough, body aches, or temperature over 100.4 would be cause for, you know, probably going home during this pandemic in particular.
Okay. Dr. Rabinowitz, anything to add to that? Or
No, I think people need to really be trained on that and not be heroic, and that it's a big culture change, and medical professionals are some of the worst at that. We're all used to showing up to work sick because we think nobody else can do our job, and I think that is seriously in need of training and education. That's not something that people will do lightly. It needs to be a culture change, just like building a safety culture. This is sort of building a health culture, and it's not easy, and it's a significant effort, but I think it's worth it.
okay, thank you. Jill, have any other questions come in?
Yeah, just two things. So Alan had also commented on the assembly line concerns around how fixed they are and you can't expand them, and that how vital these operations are to feeding the US and the world, and that they are having a hard time getting PPE. Thank you, Alan, for that comment. Baron had a question in regards to ventilation systems. What aspects of a quarantine isolation room, such as these newly acquired motels, pop-up tents, or other isolation areas, should be adhered to?
Okay, so who would like to take that question first?
I'd love to defer to the industrial hygienists on that one. It's a great question, and I'm not sure we know the answers totally.
John?
So with the isolation rooms, the primary purpose is to prevent spread from one room to another. So you have the negative pressure system, negative pressure ventilation, you're drawing air out and then making sure it gets filtered and dealt with. With some of these things like the tents that are popping up, one of the advantages you have there is you don't have a shared contiguous airspace with other facilities. And so you have that isolation through distance without having the ventilation in place. It's going to be want to do things to prevent the contamination from going from one location to another within the facility. And so that's the key thing to look at. And I know some facilities have ways to be able to amend their facility using poly sheeting, things like that, to be able to put up walls and barriers to provide a greater isolation. And there's a lot of ways to address that. And with some of these temporary facilities, it is actually pretty well thought out.
Okay, thank you. And there was during the SARS epidemic, 2002, 2003, there was a case study where residents of an apartment building, the Amoy Garden Apartments, were transmitting the SARS virus, even though they weren't coming into direct contact. They later found that it was being transmitted through defective plumbing systems. It was being aerosolized through the plumbing system. The P-traps were not working as designed and allowing aerosols to be transferred between apartment buildings through the plumbing system. So I think one lesson learned from that, that virus was genetically similar to the current COVID-19. I don't know if that's a transmission route with our current virus, but just erring on the side of caution, I might recommend that check your plumbing systems, make sure your P-traps are working.
And I think it was also a matter of backflow protection in that building. They didn't have proper backflow protection, so water could be drawn up into the system from a sink, like a hose going into a sink, could draw it back up, and then it would come out in the adjoining apartment.
Yeah. Okay, thank you. Anyone else care to elaborate on that question?
I'm gonna follow up on this topic from Terry O'Leary. Do steamers decontaminate, and should we use HEPA air filters?
I personally think if you can swing it, that it makes some sense. They certainly have isolated virus, including influenza virus, from air filters in HVAC systems. And so depending on your HVAC system and with the potential of putting a HEPA filter in, I think that's a reasonable investment to make if you're really going to try to retrofit a motel room or anything like that.
John?
Yeah, and a lot of times, if you're taking a facility that you can look at balancing the system, rebalancing it to increase more outdoor air flow, doing other things to bring in air, but you want to be sure to balance it so it's not pushing air from one contamination area into others.
Yeah, that's a good point. Any other thoughts? Matt, any thoughts on this?
Basically, no. I think everybody's everybody's mentioned. I think the getting back to we started with the fisheries. Again, that's something they need to think about before they get on the ship, because once you get out on board the ship, I was with the Coast Guard for 27 years, so I kind of understand that whole industry pretty well. You need to have some plans in mind on if we're going to have to set something like this up. We need to have the materials and the things that we need. So again, I can't say it enough. It's all about planning and looking ahead. So.
Okay. And Dr. Cherry, did you have any comments?
Well, I was thinking about the ventilation system again, and I thought with the first SARS epidemic, their bathroom exhaust was getting into the air intake of an adjacent building at one of the hotels. So, if it is spread through fecal particles, bathroom exhaust could be important. But really, I think it's important to focus on the main means of transmission and the main way to prevent transmission. Again, it's hand washing, social distancing, and staying home when sick. Some of these other measures, like increasing ventilation, that can help a little. It's not nearly as effective as hand washing, staying home when sick, and social distancing when you're talking about actually preventing transmission of illness.
Okay, thanks so much.
Dana, one more thing.
Sure.
Continuity of operations planning. In other words, what I'm saying is, we talked about planning, but we need to look at, if we're, like, say we have an assembly line or something along that line, what are the critical areas that need to be there, and is there a way we can reduce that? If you thought about that ahead of time, you might be able to reduce the amount of people that you need to run that operation safely. So again, it's going through and thinking through that whole process that can help you really help reduce exposure, because you may not have to have that many people, or you may be able to set up some type of rotation, something along that line.
Yeah. And Matt, thank you for bringing up continuity of operations. In an ideal world, we would have developed our continuity of operations plans long before this. I know in my last job, we really kind of had to make it up as we went along during H1N1. And I know there's a lot of businesses who may be in the same position now, figuring out your continuity of operation plans at the same time you're trying to implement them. And Matt sent us a number of great resources on continuity of operation, which we'll be adding to our resource page that we will send out to you. Okay, thank you, Jill. Are there any other questions coming in?
Yes, we have one from Kate Durand, CE Zone Kate Durand. Is there evidence that there's transmission in water? For example, crowds swimming at the beaches?
All right, who would like to?
I'm not aware of any evidence for that.
Dr. Sherry?
No, I've seen some things on CDC. I mean, there are some studies as to whether the virus can survive in different media, but I've not seen anything about disease transmission from water.
Yeah, Matt or John, have you heard anything on that topic? John shaking his head no.
No, yeah, and I haven't heard anything one way or the other, but the focus has been on the primary transmission route.
Yeah.
Same here.
Yeah. Yeah. if we do find any resources on that, we will add that to our resource page. But as of now, I don't think we have an answer to that question.
We have another one from Dr. Yost. Could the COVID virus survive in swimming pool water that is treated with chlorine?
Well, looking at our disinfectants, I know Nancy and Matt have done a lot of have a lot of knowledge on disinfectants. So maybe Nancy or Matt, you can take a stab at that question.
Chlorine takes, I don't know you'd have to test it. In other words, you don't really have the information. Is the amount of chlorine that's in there, they also have swimming pool systems that have ultraviolet setup that water goes through. And again, with COVID, I have no idea.
Right. The EPA has as far as swimming pools and that kind of source, I'm not as familiar with either, but I do know that, looking at the CDC guidelines, they are recommending a variety of different disinfectants, and we've organized them based on kind of like what are the safer ones. There are safer disinfectants as well as safer cleaning agents, and we're going to provide some information on what those are. Looking at the Environmental Protection Agency's Safer Choice program, as well as the Design for the Environment. We know that the alcohol, ethanol, isopropanols, and hydrogen peroxide are just as effective with the coronaviruses, but there does need to be more testing. We're using this based on previous studies, not with this specific virus. So I think Matt has the right answer that we need to study this and look into it. But that's the guidance right now, and it's on the CDC's website.
And again, this is a new virus, it's a novel virus, and learning more every day, new guidance is coming out every day. So I think as of right now, we don't have any guidance that we can specifically point to on that. Hopefully we do.
Dana, I would suggest though, the Washington State has really put together some really good information on those types of things. So, I would just suggest to people, industries, check on your state public health sites because they're going to pull the stuff in from CDC and so forth and so on.
Yeah.
Right.
So that's where they can go. If it's not there, then they're just going to have to work with local public health.
Yeah, and right now in a new pandemic, we make the best decisions we can given the information we have. We don't always have information that addresses the specific issue that we have. So we make recommendations based on what we know maybe from other similar related viruses, past pandemics, but a lot of our recommendations are based on, what's come out of our pandemic flu planning. And as we learn more about this COVID-19 virus, our recommendations can change. So that's, I think, just kind of the nature of the situation we're in is that we have recommendations today. Next week, we may need to update those. And that can be frustrating for members of the public. And it can be confusing. And I think as we manage our risk communication, we need to be sensitive to the fact that our message may change.
But the thing is, Dana, is the companies themselves need to be responsible for if they can, to have someone just like social media, having somebody watching on the various sites to see what's what. It's not like this is now part of the job that they have to have. Okay, so.
Yeah, I think that's a good point. Somebody needs to be monitoring this. And when I teach OSHA classes, we provide a lot of information and, somebody can take an OSHA class and walk away with information that's going to be good for, the foreseeable future. That's not the case right now. So I think that's a good point. Having somebody on board who's monitoring updates, we'll post updates to our resource page, but Definitely CDC, Department of Health, your state, county, local departments of health. They're going to have great resources for you too, and expect the recommendations to change. Okay, Jill, any other questions?
It looks like we have just two more. Occupationally, is there anything to know about access to tests from an occupational context?
Oh my, who wants to start with that one?
I could say a couple of words. I mean, I know at our own hospital at HarborU in Seattle, we certainly have a protocol for prioritizing testing. There really aren't enough tests for anyone who wants to be tested to be tested. And plus, even if someone tested positive and they're in a low risk group, it wouldn't really change the management. So, you know, I think a limited number of tests that are available at this time are prioritized for high risk groups and special populations like healthcare workers. Some of the same people who are kind of at the top of the list for getting PPE are kind of at the top of the list for testing. So hopefully we'll have more tests in the future. Right now, we don't have the test widely available for the public. I was thinking about that question about what if we have a positive in a remote fishing village? I don't know if tests are available in remote areas right now. I mean, that may change in the future. There may be new testing methodologies that come out. But for now, testing is limited, and especially limited to special populations and high-risk groups.
And I just wanted to add to that, that it's really been a big problem that the testing's been so slow, and we're way behind other countries in getting test availability to other populations. We keep hearing that it's going to change, you know, in the very near future, and it hasn't totally done that yet. As Debbie says, there are a bunch of private tests coming online, and so we really do expect within the next week, and I've said that before, that it's going to be much easier to test. There's going to be some free testing available through some of this federal legislation. And so I think testing's going to be something to really watch closely, and it's going to be more of an option. And however, the test currently, technology-wise, is a test that needs to be done in a laboratory. It takes a day or so turnaround. Obviously, some ships have abilities to airlift out supplies and test to a lab reference somewhere else. So that's one way it could be done. It's not a rapid point of care test yet. I think that's further away. I think there is going to be a chance for fairly low cost testing in the very near future. And I think the industry needs to watch that very closely.
Yeah. Matt, any thoughts? Do you have anything to add?
No, it's basically you're having, we don't know what's going on up at the federal level, you know, in CDC level, that we know that the testing is getting ready, you know, to come out with the big pharmaceutical companies to get started, but it's still going to be linked up with, you have to get some type of swab, and it's got to go through a system to get there. So if you're in isolated areas, you're going to have to look at basically some type of list of what type of symptoms people are showing. So again, you got to work that out.
Thank you. All right, Jill.
We have one comment from Mary Miller on a follow-up from the swimming pools. She's read that infections emerging through swimming pools are enteric-based viruses like norovirus, adenovirus, Hep A, etc. And then I think we have one last question, and this might be a good wrap-up actually. It speaks to more of the psychological impacts of this pandemic that are happening, especially from the perspective of employers. What are some recommendations to help mitigate anxiety amongst your employees?
Oh, can we start with maybe Dr. Cherry and Dr. Rabinowitz? Are you able to answer that question?
Well, we're offering some meditation resources as a personal thing that workers can do. And that's what we're offering through UW Medicine, meditation, and you know, the culture helps, saying we're all in this together, having clear lines of communication and policies, and trying to address any misinformation that may come up through social media. Those things can be helpful.
Yeah, I think real leadership in the corporate side of setting the tone for the company and making it okay to call in sick, making it okay to test positive, or just be prepared for the eventuality of that. Realizing that everybody's just got all these other pressures of kids not being in school, and knowing family members who are having some other disruption. In Seattle, we're starting to know personal friends or people very close to us who've died. That's a real wake up. And so it's very important, I think, leadership at the top to set the culture for the organization, as Debbie said.
Yeah, and the resource page that we're putting together, we've added some links on psychological effects. And one resource that maybe would help to take a look at is, we have some resources on psychological first aid, which is something that's used quite often, or it's widely adopted in disaster response. And it really looks at people, I mean, people have, you know, maybe long-term anxiety, and then sometimes you have people who really get to the point where they have, you know, an anxiety moment, and how do you get through that? And it's especially important when the person who's having an anxiety moment is also performing a critical task, and you need that person to perform that job, perform functionally, and to make good decisions, despite the fact that you're dealing with something kind of traumatic. So there's 8 core steps to psychological first aid, such as, you know, maybe somebody who's kind of having a moment, you know, helping ground them, getting them to connect, you know, take deep breaths, come back to earth, focus on what they need, making them comfortable, and really kind of working them through that moment until they're at a point where they can perform again. And again, this is especially important for people who are performing critical work, you know, people who are working in critical infrastructure, healthcare workers. Healthcare workers, I think, are some of the workers that I'm most concerned about. They're at risk for burnout. They're at risk for compassion fatigue, which is, you know, just from having to be so compassionate, working hard, being tired. At some point, it's hard to be, you know, keep that up. Matt, any other comments? You're on mute right now.
So crisis incident stress management, those techniques that are set up along that line, they have you know, there are things that we should be incorporating into any emergency of this type, because you're going to get people who are going to be doing some type of PTSD response to this, particularly if you know, family, somebody dies, you know, all that kind of stuff. I sent you something in there that I think you put on your list for that. But essentially, if you've got people set up, and we do this when we're doing emergency response all the time, is we bring in our crisis and stress managers and set up automatically, because we know there's going to be issues, not just with the people and the actual people being affected, but also the people that in your emergency management response program. So something to think about. And again, that's part of your planning process, is to have that set up. And it's going to be long term. This particular incident is, you're going to see effects in the industry, in the population for quite a while from this.
Yeah, and employers who maybe don't have access to a critical incident stress management team, a lot of employers do have EAPs, employee assistance plans, and make sure your workers have the phone number to your EAP and encourage access to that. I think it's important to recognize that this is a stressful time. And you see this in the community. You have people who deal with stress in different ways. You have people who minimize it. You have people who, you know, buy a garage full of toilet paper. People react in different ways. And, the person who's minimizing the disease, thinking, I don't see why the government's making such a big deal. We're not going to, they're dealing with stress too. It's just, they're expressing it in different ways. Okay. Any other thoughts or comments on this topic?
Just over the last couple of weeks, a lot of what I'm seeing are people who are not being given good information about what their business, what the company is doing about this.
Mm-hmm.
And particularly when it comes down to when you have people who have gotten sick and left the workplace, being sure that everybody else is aware of what the process is for doing the cleanup and to get things back to work. And that there's a lot of this that it's not new science. We don't have the new science for this one yet. It's the basics, the cleaning and the hand washing and just basic hygiene that are going to be effective, and showing people that where this is coming from and why this is what's being chosen to do, why they're choosing to do what they're doing, so they understand that it's being done in a way that'll protect them.
There were studies that were done after H1N1 looking at some of the indicators of psychological, adverse psychological outcomes. Some of the risk factors for adverse psychological outcomes, one of them was constantly changing recommendations. So I think that's an important, maybe one day we're recommending you stay 6 feet away. Maybe tomorrow you were saying people need to stay 10 feet apart. So as our recommendations change, I think keeping that in mind as we manage our risk communication, if we're constantly changing our recommendations, that causes stress for people. So if we are making changes to our recommendations, I think it's important to explain why. And, why do we make the old recommendation? What was that based on? Now we're making a new recommendation. We acknowledge this has changed. Some of the other risk factors for adverse outcomes included people being quarantined, isolation, knowing somebody who was sick, having a family member who was sick, not being able to visit the family member who was sick. These are all things that contribute to stress, and along with just the stress that comes from a hazard that is out in the environment that we can't control. Those are the type of risks that cause greater stress among people. So I think acknowledging it, and like Dr. Cherry was saying, having meditation sessions, practicing self-care. I think as we're making recommendations about hand washing and sanitation, we need to be making recommendations for self-care as well. I think that's a great point.
Yes, thank you so much, Dana.
Mm-hmm.
And everybody, thank you all for participating in today's roundtable. This has been a great discussion, and we're very appreciative of everyone's time, and we hope our participants and our students appreciate the new format that we tried today. And your comments and evaluations are so important as we move forward and try to continue to provide the most knowledgeable and experts to you. So thank you very much.